Hi, Linda. I am really excited to have the opportunity to talk with you today about the revised statement that ANA is issuing on the impact of fatigue on the nurse and then ultimately on quality of care. So can you tell me, as you've been studying this the whole area of workforce, but then also having identified some findings around fatigue, what do you think is the most important thing for nurses to recognize in terms of the impact of fatigue on the quality of care?
Well, what makes nurses so unique in healthcare is that they are this surveillance system. They detect things early on and they mobilize a response to save people's lives and to prevent adverse events. And it's really that surveillance system and the vigilance that goes along with it that's eroded by fatigue. So that's what makes it so important to reduce fatigue in the clinical setting, so that we maintain high levels of vigilance and surveillance, which is what patients depend upon nurses to do.
Let me talk to you for just a minute about the individual nurse, because as you well know, the nurse feels that responsibility to be that surveillance system, and they go above and beyond, and they will volunteer to work long hours. They know they will need to be there if there isn't someone to relieve them. So what kinds of things should we be encouraging nurses to rethink about remaining healthy, and again recognizing that they also have to be their own surveillance system for their own fatigue levels, in addition to looking out for the appropriate staffing levels in their work area?
What our research is about is what happens in the practice setting. And there are two major factors that create fatigue for nurses when they get to work. And one is not having enough staff. And the second is having very poor work environments that erode the efficiency of nurses. And interestingly, about 30% of nurses say they are working in poor work environments. So this is a big source of fatigue and emotional exhaustion once nurses get to work.
The kinds of things that you have just hit upon, again, are really important issues for nurses to begin to have a discussion with their coworkers, with their management, with their organizations, to say, how do we balance the number of hours that nurses work with an appropriate schedule that will work for them, at the same time looking at these issues of burnout, looking at the issues of turnover, which creates inconsistencies in care, which isn't good for patients, because nurses would never willingly do something that wasn't good for patients, and we want them to take care of themselves and be healthy themselves as well.
Nurses that are working over 12 hours, which are the 40% of nurses that can't leave, are more likely to be involved in a mistake. They're much more likely to be burnout, and that burnout is very hazardous to patients. So this suggests that nurses themselves need to think hard about taking on overtime, and that our hospitals need to think about more accurate projections of how many staff they really need, so they're not caught at the last minute and putting nurses in the position of staying there when it may not be safe because patients aren't needing them. So really dealing with this overtime and considering it as a hazard, I think, is good for the nurses. I mean, we think we are sacrificing for our patients if we stay overtime, but we may not be doing them a favor.
Good advice for us to really be looking at how do we create that dialogue with our staff, with our organizations, and really say it's very important to have safe staffing that also protects the nurse. I think the bottom line is that overtime should not be a staffing strategy. It should really only be used as a last resort in an emergent situation.
And our research also provides the scientific basis for the recommendations that the ANA has made about nurses not working more than 12 hours in a 24-hour period, not working more than 40 hours in a week. All of our research suggests that once you get beyond those particular dimensions that are recommended as guidance to nurses, that bad things happen for nurses and for patients. Nurses are the infrastructure for safety. So I think we have to see ourselves that way and be very cognizant of the importance of coming to work so that we are rested so that our vigilance is at a high level and that we can be the best that we can be every day for patients.
Thank you, Linda. I think that really sums it up. This is really a shared responsibility between nurses and their organizations, and I look forward to seeing improved results as these are put into motion.
Thank you, Pam. This has been delightful to have a chance to talk to you about our research.
Great, thank you.